everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to invite all the viewers who have joined us today. So, today in this discussion, we are going to highlight and address the urgent issue of increasing Mpox cases globally, where we'll explore about the causes, treatment, transmission, preventive strategies, and much more. So to begin with the discussion, first I would like you all to join me in welcoming our experts for this panel discussion. So first I would like to welcome Dr. Manu Chaudhary, consultant pediatric infectious disease, Rainbow Children's Hospital, Bangalore. So good evening, Dr. Manu. Welcome to the panel discussion.
Thank you.
Next, I would like to welcome Dr. Rohit Garg, consultant infectious disease, Amrita Hospital, Faridabad. Good evening, Dr. Rohit.
Good evening.
Welcome to the panel discussion.
Thank you.
Moving ahead, I would like to welcome Dr. Aparna Chakravarty, Associate Professor, Pediatric Infectious Disease, Amrita Hospital, Faridabad. Good evening, Dr. Aparna. Welcome to the discussion.
Good evening.
Moving ahead, I would like to welcome Dr. Shareek, HOD and Infectious Disease Specialist, SUT Pattom Hospital, Kerala. Good evening, Dr. Shareek. Welcome to the discussion.
Good evening. Good evening.
And I would like to welcome Dr. Kavita Krishna, Director of Medicine and Rheumatology, Sahyadri Super Speciality Hospital, Pune. Good evening, Dr. Kavita. Welcome to the discussion.
Hi, good evening.
So let's delve into this insightful and informative discussion for the Mpox. So first, I would like to discuss what exactly the Mpox is and about its feature. So I would like to ask Dr. Kavita, can you please provide our viewers with a brief overview of what exactly the Mpox is and how it is different from other viral infections and other pox-like virus diseases?
Yeah. So, monkeypox, it was as earlier called, or Mpox, is a viral zoonotic disease. In the sense, it originated in animals, like the monkey, for the first time in 1958, where the experimental monkeys in Denmark were discovered to have the monkeypox. And then in 1970, the first human case in a 9-month-old child in Africa was discovered. And subsequently, there have been sporadic cases all over the world. But in 2022 and now in August 2024, the WHO has declared it as a global health emergency. Now, the global health emergency or public health emergency of international concern is different from a global pandemic. In pandemic, things just happen and there's no guideline, there is no method of controlling an infection. But when you declare an international global health emergency, the WHO officially declares it, and each country can have a plan, a strategy how to handle or tackle this infection. That is first. So the monkeypox virus, or the MPXV that it's called, is it belongs to the genus Orthopox virus or the Poxviridae family. So earlier, what we knew was the smallpox. In 1980, the WHO declared it as eradicated. The other pox virus, pox infection, chicken pox, is by a different virus altogether, which is the varicella zoster. Pox-like lesions are also seen in some infections like rickettsial pox, but that is a total different organism altogether. There are two clades, 1 and 2. So earlier what we had was the 2B strain in 2022. And what we have now, what is worrisome to us, is the 1A or B infection strain that is prevalent right now, the increasing number of cases. And as of now, around almost 1 lakh of cases have been reported all over the world and 116 deaths. So by and large, it is milder than smallpox infection. Smallpox used to be more morbid, more mortality was there. And overall, Mpox is supposed to be like sort of self-limited, though it's a prolonged course. Though there can be cases of complications, especially if they're old, immunodeficient, or if they're very young or pregnant women. The lesions, the illnesses like any other viral illnesses start with the sore throat, but they get painful rashes. The rashes that they get are painful, and they look a little different from the different rashes. They have little redness, then later on they become like vesicles, and they're blackish, like eschar, like look like a scrub typhus, but they are like a little more extensive all over the face, hands, etc. They get painful neck swellings or nodules, and I'm supposed the detailed description of the symptoms will be given subsequently in this talk. So right now, for India, the last case was described, I think it was reported in March 2024. But we need to spread an awareness. That is the thing, because once it's a global health emergency, we don't know when the cases may suddenly increase. So it's important to spread awareness, to know what it is and how to prevent it.
Yeah. So thank you so much, Dr. Kavita, for help our viewers to understand like what exactly the mpox is and how it is different from other viral infections. So moving ahead, if we talk about the symptoms evolution of mpox, so I would like Dr. Shareek to tell us, like, could you please just explain, like, in what ways do the symptoms of mpox evolve over the time, and what are the typical stages of the illness? Dr. Shareek, you are not audible. I think it's mute.
Can you hear me now?
Yeah, I can hear you.
Yes.
Yeah, thank you, thank you. So I don't know how many of you have seen mpox in your clinical practice, but I was the one who has seen an mpox in the last death, which was happened in Thrissur. I was involved in that team. So I don't know how this question came straight to me about the symptoms also, because that was very puzzling scenario. But if you read the descriptions, what you see is that there will be a prodromal symptoms like any other viral fever. You have headache, fever, and then you have the typical difference. What you see initially will be there will be generalized lymph node same. Then over a period of time, 1 to 3 days time, what happens is you start with small lesions, erythematous lesions, which gradually progress to from the macules to the papules, and then it becomes vesicle, and then some of it will be umbilicated. So it may look like even a molluscum contagiosum. So that's how it is there, and then it just crusts over a period of 2 weeks time, and then falls off. This is the natural progression of the lesions, and the lesions will be painful. This is what the textbook descriptions or what you see in this Google. This is the symptoms what you see in all these patients. Now, what happens is many a times these lesions, unlike in chickenpox, is more of extremities. You get more in the palms and the soles. This is how the typical description. And then what happens is some patients go into a late stages at the end of first week or so. They go into complications. So in our case, in the case which we saw in Thrissur, actually there was no rash at all. There was no rash at all. So that was a difficult scenario where the patient presented with a symptom suggestive of an encephalitis, and what the difference feature was, lot of lymph nodes was there. So this patient was somewhere in outside in UAE, came in, we examined, but we couldn't find a single lesion. There was only one punched out lesion in the scrotum, which we don't know. It doesn't look like a vesicle at all. It was a punched out lesion. And then they came out with the result that that lesion they had taken for PCR and outside lab in UAE, and it turned out to be monkeypox. So what you see in the descriptions may not be what you see in the reality. There was only one lesion which was taken for a biopsy, so we couldn't identify it. On the first step, we couldn't identify it. But the major difference was the painful cervical lymphadenopathy. That cervical lymph nodes or the disseminated lymph nodes is the typical finding which differentiates this mpox from the rest of the syndromes. That's how I could
Dr.
have.
Shareek, can I
Case
ask you a
report.
quick question?
Yeah.
Was it an older patient? Because I know some of the adults have received smallpox vaccine. Was it an older patient, and that's
No.
why?
It was a young chap. He was actually in UAE. So he had encephalitis and was airlifted. So he came in here. When I saw, the only difference was that he had lot of lymph nodes.
Okay.
And except that there was one lesion in the scrotum, which cannot be called as a lesion at all because they have taken it for biopsy. So as such, if you look into the definition criteria, there should be a rash with fever, right? So it was not fitting in with any of the probable or even the suspect. But then they came out with that result on the PCR from that, and there we identified that it is a monkeypox. So it was not a great job from our side. Even you can see without rash also. That was one of the things which I felt. Just one lesion, and it was taken for biopsy also. So what you see, what you read may not be the truth many a times. Beware of this thing. It may mislead us. Thank you.
Thank you, Dr. Shareek, for providing this insightful experience that you had. So, moving ahead, if we talk about the transmission, so I would like Dr. Aparna Chakravarty. Can you please like explain how it transmits, like, and most common transmission routes for mpox, and how these differ from those other viral infections?
Yeah, so transmit mode of transmission, transmission we need to understand for any infectious disease because that is how we are able to prevent. So talking about Mpox or monkeypox as it was previously called, it's been a zoonotic disease as already mentioned, and it has a potential for both animal to human and now it is human to human transmission. So the animal reservoirs were initially from squirrels, rats, monkeys, which contributed to the diseases spillover into the human population. So when we have any disease transmission, there are three methods by which they transmit: contact, respiratory droplets. These are mostly viral, and then there is airborne. So for Mpox, it's predominantly through contact and respiratory droplets. So contact. It's also been seen by both direct and indirect contact. So direct is when it's from the lesions of the exudates from the lesions can spread the disease, or even from bodily fluids. In particular, now the proliferation is seen more in the sexual network of men having sex with men, and so the sexual transmission is also there for Mpox. Now, this is at par with other viral diseases that we see, which are spread by respiratory or contact, as we have already talked about chickenpox, we've talked about measles, we have all the other viruses which are transmitted in a similar way. So we see that Mpox can be transmitted in many ways similar to existing viral infections. So the other possible routes of transmissions are it can be vertical transmission, that is, a pregnant woman can transplacentally transmit the virus to the fetus. So there is a transplacental transmission which we see with other viruses like cytomegalovirus, HIV, and so on. And there is also a potential for transmitting via breastfeeding. Now, understanding this modes of transmission is very important, as I said, for prevention of the disease. So here we do not see airborne transmission. Airborne transmission meaning that it is not, this virus is not unlike what we had seen in, say, influenza or COVID-19 that needed, social distancing or N95 masks. So there is nothing like that. It is more with the contact, bodily fluids, direct or indirect contact, bodily fluids, and respiratory droplets, as well as vertical transmission. Thank you.
Thank you, Dr. Aparna, for telling us like how it transmit. And I think one layman can understand it ki how it transmit and how we can prevent it at our level. So, moving ahead to Dr. Manu Chaudhary, I would like you to please explain about its epidemiology and the trends, like which group of people are experiencing a higher incidence of Mpox, and what might be the contributing to this trend in the broad aspect.
Sure. So we know the most cases are being reported from West and Central Africa. DRC being the most affected country. It has been endemic in that country, the infection, and around this year they've had 18,000 cases with more than 600 deaths. Most affected population is children, and that's what worry me as a pediatric infectious diseases physician. More than 70% of their cases are below 15, and of those 40% are below 5 years of age. Even the mortality is higher in the children, 4 times compared to the adults, with the individual percentage of 8.6 versus 2.4%, as quoted by WHO. The and this was the reason why the spread led to even the countries which were not endemic with this infection. So neighboring countries like Uganda, Rwanda, Burundi also started seeing cases, and that led for WHO to declare it as a public health emergency of international concern. The recent clad Dr. Kavita already talked about is 1B, which is concerning. People are talking about it's being more transmissible, more deadly, but we still have a lot of information gaps about the same. In regards to cases internationally, so far during this 2024 season, I think there have been one reported case from Sweden and one from Thailand and probably one from Philippines. We've already talked about cases in India. Fortunately, currently in August, we don't have any reported case. The government is really up and about screening these cases and spreading information. what could have contributed to this epidemiology is, I think this is not the first time DRC is having this epidemic. They had this in 2020, 2022, which was actually was not just limited to Africa. We saw it in 112 countries, more than 100,000 cases, but those cases were mostly in men having sex with men. Now, these current cases are in family cohorts, spreading in children in large numbers. So that's really concerning. And what could be the contributing factors is a lot of these countries are war-stricken. They live as joint families. They have a bracing culture. So if anybody gets sick, people hug, they love, So even the limited information about transmission is happening is also leading to this kind of spread. Malnutrition has been contributed as one of the reasons why we are seeing more mortality in children. But again, there's a lot of knowledge gap. And the last point could be unavailability of the vaccine in these particular countries.
Thank you. Thank you so much, Dr. Manu, for providing us with this insightful information and with these precise stats. So, moving ahead to Dr. Rohit Garg, I would like you to please provide us with the prevention and the cares. Like, what are the best practices to avoid Mpox in high risk environments or during the outbreaks? And what are the measures that one should take care of?
So I think in the today's discussion, this is one of the most relevant question for all the listeners, like for all the layman community person, all the healthcare experts. So the preventive measures for any kind of infection, it basically depends upon the type of precaution, type of transmission which is associated with the pathogen, like Dr. Aparna has highlighted. So there are three types of transmissions which are contact based, airborne, droplet precautions. So if we have a clear understanding of this type of transmission, so we can understand what type of preventive measures needs to be taken. So there are some general measures and there are some specific measures which are transmission specific. So general measures may include, like if there is an outbreak situation, then population should be informed. They should stay informed about any kind of latest guidelines or health advisories or from the national or international authorities, so that they know what needs to be done if there is a case, if there is a if they contact they have a contact with a suspected case, if they get any symptoms, and then what to do. Then if there is a country where cases like in the current scenario, there are a lot of cases in Africa. So it is best to avoid travel which is not very essential. So if it can be avoided, that is good. Then any kind of contact with animals should be avoided, which can have a potential risk of transmission of such pathogens. Then adherence to some protective measures. So if we talk about the transmission, so it is basically contact based and droplet precautions. So we need to take care of these transmission only while we consider the precautions. So for example, avoiding contact with the suspected patient, whether directly or indirectly. So we should avoid direct contact, and we should also avoid indirect contact, like touching any kind of objects which has been used by the affected person. Then maintaining good health, the good hand hygiene practices, which is very important. So because most of the transmission is contact borne, so we need to take care of our hand hygiene, keeping hands clean in between the contacts, like after taking care of the affected patient, after if particularly if it's a confirmed case. Then in healthcare settings, it is very important to take care of use of personal protective equipments. So it is mostly in context of healthcare providers. The use of masks is very important, and whenever necessary, then use of gloves and gowns also is important. So like second aspect is, if there is a potential exposure, so people should be aware about identifying the symptoms, so that they can have a early suspicion of like whether they have monkeypox or not. They should seek healthcare as immediately as possible, so that if there are there is a potential exposure, so there are symptoms are early identified, that gets easily early diagnosed, and if there are any complications which needs to be monitored, so that can be monitored in the early phase of the illness.
Thank you so much, Dr. Rohit, for providing us with a good set of preventive measures that one layman can understand and should take care of. So, moving ahead with the discussion, I would like to ask Dr. Kavita Krishna, like if we talk about vaccination and the importance of vaccination in terms of Mpox, how important it is to prevent in the prevention of Mpox, and what are the current recommendations of the vaccine use? Dr. Kavita, you are on mute. You're not audible.
Yeah. So in 1980, after the this eradication was declared of smallpox by WHO, so currently we don't have any vaccine in India. But the Serum Institute in Pune is in the process of developing, manufacturing our own vaccine, maybe by next year. Currently, there is one vaccine by the name of Jynneos TM, Imvamune and Imvanex in the United States, and this is licensed in the US. And many countries like Japan, etc., have already stocked up this vaccine for the upcoming, if there's a surge of cases. And this can be given pre-exposure or post-exposure. So, if pre-exposure, as Dr. Rohit said, the ones who are healthcare personnel who have been in contact with a known patient, they can take this vaccine. Uh, Post-exposure also there is a role. Like after 4 days, within 4 days is ideal, but up to 10 to 14 days, if the contact does not develop the symptoms or the infection, can take the vaccine. And let us see, like if the vaccine is manufactured and easily available next year, and with the countries like Africa, the vaccine should be made available in good quantity so they can get the benefit, and the infection can be stopped from spreading to other countries.
I just want to add to that, Sumedha. So there
Yeah.
are Genos is one which is through Bavarian Nordic in Denmark, and then there is another one, LC16 by Biologics in Japan. Now LC16 has a history of usage in children. Now that's what they are trying to get to Africa and get it started for the children there, because that's the highest number of affected population. And Genos was used in US, as Dr. Kavita said, for more than 18 years of age. It was approved, but was used in children and pregnant women as well. So that's another. These are two candidate vaccines which all the countries are trying to pool into Africa. But again, the need is in millions. But currently it's gonna it's not. It hasn't reached yet, and it's gonna take some time to even reach the demand of the country.
Yeah, very rightly said, Dr. Manu. So, thank you so much, Dr. Kavita and Dr. Manu, for providing us with the insights on vaccination. And then moving ahead, Dr. Shareek, if we talk about the treatment options, so what exclusive treatment options are available for Mpox patient, and how we can compare the treatment to the other viral infections?
Well, this is a relatively new disease, so the
Yeah.
availability of specific drugs are very limited. So if you look into the guidelines, there are no specific antivirals which has been approved for the treatment, and the treatment includes only symptomatic. But since 2022, there has been a lot of cases in. So there are newer antivirals which has been tried for in this Mpox patients. One is a ticovirimat, which is a specific antiviral which can be used. And there was one study which said from the Africa, where they said that it didn't affect much of this skin rashes, but the mortality rate was comparatively little bit less when compared with the normal patients where treatment was not given. This is one of the options, and US agencies are doing a study on this one, whether it is very really useful or not. One of the drugs which is available for this one specifically, and then another one is brincidofovir. That's another drug which is being proposed as a treatment option, and there is one another antiviral called cidofovir which has been using for some other purposes in the viral treatment. This can be given, and there is a vaccinia IVIG. It's an immunoglobulin, so that also can be tried as adjunct measures if these are all the available options. But the problem is that we really don't know whether these works or not, because these are all really newer drugs and it's not available at all, and all are in just phases of trials, and we are not very sure whether this works or not. This is how it goes on. And And coming apart from the treatment of the viral infections, there are very few viral infections you have actually specific antivirals. For example, you have some herpes virus, you have HIV virus, you have hepatitis B virus. That kind of things, we have a lot of this viral infections, you have a lot of antivirals, and even your flu virus. All the common things have. But many times what happens is most of this and newer ones, and it cannot be compared like antibiotics. You can change inter-exchange. That cannot happen. So we use one set of drugs for one virus, cannot be inter-exchange to this one and give a try. That's not how we work with this antivirals. You need specific antivirals for that specific virus. That is how it goes on. That's why this treatment options for viruses are a little bit difficult. Whereas if you treat a bacteria, that's not how it works. You have an antibiotic, it can work for all lot of all lot of bacteria you can use. But this one we need specific one, and as such WHO is also promoting a lot of research on mpox treatment developments. As it goes on, probably we get better drugs and better options for this. Thank you.
Yeah,
Just
another
adding,
challenge.
I think IVIG was another thing which they have used in immunocompromised
Correct,
folks.
correct. They have used the vaccine IVIG, they have used in this one. But all those things
This is
are in
even
just trial phases, not as an approved
yeah,
guideline kind of stuff. So we'll
I
have
think
to wait and
another
see how it
challenge,
goes.
yeah, another challenge is the treatment or management of the skin lesions.
Yeah,
They are quite troublesome. They last for almost 2 to 6 weeks, So
exactly.
they get infected and all. Yeah.
And then the pain is also very excruciating pain they'll have. So
Mm.
that treating the skin lesions is a little bit tricky. That we need to give only the symptomatic management.
Thank you. Thank you so much, Dr. Shareek, for providing us with the treatment measures that one can opt. Moving ahead, I would like to ask Dr. Aparna, like, what are the recent advancements we have, like, that have been made in developing new therapies or new vaccines for Mpox?
Okay. So as we've already been told that we have very few antivirals already there. So let us just look at what therapies that we have been giving right now is basically when we talk about the antiviral tecovirimet, it was originally developed to treat smallpox and is currently used as a first line medication to treat mpox. And so while we look into, there are many advancements, or as has already been told, research going on to look at more specific mpox treatment. So understanding a little bit about how this drug acts, basically it acts on a certain protein once a virus is already matured. It's called a VP protein. And so this tecovirimet actually works on that, inhibits that protein and hinders the disease progression. So with the concern is for supply shortages and drug resistance, that new potential drug targets and therapeutic options for treatment of mpox is being tried, and because the genetic material of the orthopox virus is same, so it's smallpox or mpox have the similar genetic material. So there are novel research drugs which are focusing on this same protein, but it is more said to be more more efficacy in terms of bioavailability and efficacious in an oral preparation. It's something, it's called Neoj 14, which has cleared the phase 1 trial, but still under study. And then other drug targets, as in the viral nucleic acid, where the replication of the DNA and the RNA polymerase. So those are the targets which have been looked at for therapeutic options. And similarly, inhibiting some enzymes like phosphorylation of the thymidine monophosphate. So those are still in research. Now, moving for this treatment, even repurposing of herbal formulations have also been looked at, which has shown to be of some practical solution, like African palm oil or curcumin, which has been of some therapeutic options as seen in the local area, and they are now studied for antiviral efficacy. So basically, in terms of therapeutic, right now we just have the same drug that we have been using for smallpox treatment, but yes, some advancement is going on, research into looking into more drug targets as to mpox specific. Similarly, for vaccines, when it comes to vaccines, we've Dr. Kavita has already discussed about the vaccines which are available, but I would like to again reiterate that the smallpox vaccines have currently been repurposed and recommended for use in mpox outbreaks. And although these vaccinations give cross protection against Mpox, so they're not specific for the pathogenic virus. So again, new vaccine methods, like we are looking at Serum Institute coming up with an indigenous vaccine from India. So these include various under development. So they are like using virus-like particles or recombinant protein, nucleic acid, which are DNA or mRNA vaccines, or even nanoparticle-based vaccines. So these are again being studied and being thought of bringing it to the market. And then we look at WHO is kind of looking in and tracking at advances and ongoing progress from preclinical research to development of clinical trials for vaccines for specifically for mpox, or even including those repurposed smallpox vaccine. Another thing which Dr. Manu actually talked about, children having more being suffering disproportionately from mpox as we see now. So a recent, the CEPI, that is the Coalition of Epidemic Preparedness Innovations, they have actually looked into using Genoise, that is the MVABN non-replicating vaccine in children age group of 2 to 12 years. So they're doing a phase 2 clinical trial on it. So we're seeing advancement in all these aspects as part of vaccine and therapeutics for mpox.
Thank you so much, Dr. Aparna, for providing us with this insightful recent advancements related to Mpox. So we have talked about the treatment part, sign and symptoms part. If we talk about like someone suspects with the Mpox, so what steps should be taken for diagnosis and treatments, and what precautions should they follow? I would like to ask Dr. Manu to explain this.
Sure. So I think if you think you might have mpox, which will be based on your travel, your exposure to a suspected or probable or confirmed case of mpox, you start having those prodromes with skin lesions. The first thing you need to do is isolate yourself. The second thing is plan to seek medical attention, but please inform the hospital in advance so that they can be ready for you. In a proper isolation protocol can be followed so that it doesn't spread to the healthcare workers and you are managed properly. The diagnosis confirmation happens obviously based on clinical features, your epidemiological exposure factors, and then we usually take a swab, which is not a cotton swab, it's a different swab, which we scrub over the lesion, multiple lesions, and then send that for DNA testing. In India, 35 labs have been allocated by the government, and this can be the name of the labs can be found through Ministry of Health and Family Welfare website. So from that particular hospital, the test will be sent to these accredited designated labs, and that's where the testing will be done. So it's a DNA PCR testing. If you're clinically stable, you can be managed at home. Everybody talked about supportive care, keeping yourself fully clothed, triple layer mask in case somebody is coming to help you with the food and all. Taking, and these lesions in some can be as many as 500. So they literally act like burn patients with having dehydration happening through these skin lesions. So keeping yourself hydrated, be watchful of warning signs. So if you are having difficulty breathing, if you have you feel drowsy, you feel altered mental status, or you are a part of high risk groups, so very young children, pregnant women, please seek medical help on time. And the third thing would be auto inoculation, which we all need to understand. So if you scratch your lesion and you touch your eyes, you can get keratitis. So these can be painful lesions, and when you're healing, they can be itchy. So try to apply whatever ointments suggested by dermatologists. Dr. Kavita can talk about it more, but please avoid auto inoculation. There have been cases of keratitis in a lot of patients. So that's something we need to do. And I think the last thing I want to say about this is understanding incubation period. and transmissibility period. So incubation period is you were exposed to a contact, but you don't have symptoms yet. So you can have symptoms anywhere from 5 days since exposure to 21 days post exposure. So no, that's why we are saying, okay, you might have to isolate the patient or suspected case for 21 days. Now, transmissibility means when can a case spread the infection? That can happen anywhere from 1 to 3 days in prodromal stage where they don't have much of symptoms, maybe some coryza, which could be with any viral infection, to till the lesions have all scabbed off and new layer of skin has formed. Till the new layer of skin, the patient can still spread the infection. So, and again, as Dr. Kavita said, that can last anywhere from 2 to 6 weeks. Average, we say around 3 weeks, 21 days, the transmissibility lasts.
Thank you, Dr. Manu, for providing us with these precautions. And like one layman can easily understand it and can follow for the same. So, moving ahead, Dr. Rohit Garg, I would like to ask you about what are the diagnostic tests are more effective to identifying like Mpox, and how should they be clinically setting, and how one can opt it for?
So basically, for any type of infections, there are some tests. Like it is a matlab what you can say ki if there is any bacterial infection, there is a viral infection. So there is a way of diagnosis. So we do two types of testing. One is culture-based testing, and one is non-culture-based testing. So in any kind of viral infection, the non-culture based testing is usually utilized. So non-culture based testing means we are not trying to grow the pathogen in the artificial media. We are just using other methods to detect. So for monkeypox virus, there are several testing. So most commonly used and the test of most important utility is DNA PCR testing. So what we are doing in this test is we are detecting the genome, genetic material of the virus in the sample. So this PCR test can be done from sample, either from the rashes. So like Dr. Manu has just emphasized that whenever there is a patient with rash, and that patient is going for a diagnosis, so with a swab stick we can take the sample from the rashes with the vigorous rubbing, and then from all other lesions we can take. So this is one sample. Then we can also take samples from some other areas, like if there are some genital ulcers, there are some rectal lesions, so we can take swab from those sites also. So these then we can do this DNA PCR on urine sample also. So other than PCR, there are some other tests, like we can have a idea whether patient was ever infected with monkeypox or not. So for that we can do a antibody based testing. So what we are doing is we are taking a blood sample and we are detecting the antibody against this virus. So this antibody-based testing is not of utility in a patient with acute infection. So if a patient is presenting with symptoms which are suggestive of monkeypox, in those scenario, antibody testing won't be helpful. So the role of antibody testing is usually for epidemiological reasons. So if we want to see, like if has been an outbreak recently, and we want to see that how many of these patients had monkeypox, they were not confirmed cases, but we want to see it in a retrospective way. So then we can do a seroepidemiological study. We can take blood samples of these cases and then do the antibody testing and get to know whether they had monkeypox or not. Problem with this testing is that they may cross-react with other pox viruses. So they may give a false positive result. So they may not give a true positive result. So antibody testing is not actually very much reliable for a diagnosis. Then other testing which can be done is culture of the virus we can do. So that are very like tedious, cumbersome. They cost is involved. So and specific virology lab setup is involved. So that is why viral culture is not very routinely done. But this is something which can also give us a very specific diagnosis. So if we are taking a sample from a active lesion, so we can send that sample for culture, and if there is a setup, there is facilities available, so that sample genetic material can be taken, and if it grows, the virus grows in that lab, so that confirms the possibility of this infection. And then other way of diagnosing this infection is histopathological. So for example, if we don't have the facility of doing a specific genomic testing, which is not the case, we actually can send samples to our reference laboratories. But in such cases, we can send the histopathology. We can take the tissue from the involved areas. Like if there is a rash, we can take a skin biopsy. We can send that sample to histopathology lab, and with spatial staining, with some immune staining, we can make out whether it is due to monkeypox virus or not. So, as far as utility wise is concerned, so most important test is DNA PCR, and it is useful in diagnosing active infection in a patient who is presenting with symptoms which are suggestive of monkeypox.
And I
And
think
like
the good
Dr.
news. Yeah.
Sorry, ma'am, please.
No, continue, Rohit.
So basically, I was just like completing that Dr. Manu has just highlighted that there are around 35 reference laboratories in different states of the country. So with the coordination by your own hospital or clinic and the state integrated disease surveillance team, you can send the samples to the nearby reference laboratory for confirmation of the diagnosis whenever there is a suspicion.
And the good news is we have our own kit in India. You know, this, I think India has been in forefront of a lot of these diseases. I think COVID also, we had our own kits, we had our own vaccines. So I think that way we are lucky to be in a country where, you know, within some time we are ready with our own kits. We are not too dependent on other countries to support us. So hopefully it should not be, people should avoid being panicked about this.
Right.
Yeah, so very rightly said, Dr. Manu, and I would like to thank Dr. Rohit Garg for providing us with the information on diagnostic tests. So, moving ahead with Dr. Kavita Krishna, if we talk about the public awareness, like how can public health campaigns be improved to raise awareness about Mpox and how to encourage the preventive behaviors?
Yeah, so there is no need, as Dr. Mani said, to press the panic button right now. We are uh, we are having very occasional sporadic cases, but whenever something is declared as a global health concern, we have to definitely spread awareness. So I think there's a little bit already happening on TV, and like our session today is also with the initiatives for the same purpose. So we should highlight the common symptoms and the signs which a patient can have. Then we have to identify the cohort of from where these patients can come. Like as we said, men having sex with men. So these people are often together, or may some of them are in ships for a long time, etc. So the patient should also be aware that okay, we are prone to this. And the other thing is the practitioners who are going to see these patients. So like right now in Pune, like we have a lot of dengue and chikungunya. So every fever that comes, you're either thinking of dengue, chikungunya, or maybe H1N1. Beyond that, we're not seeing much. So every practitioner will only think of these three. But supposing we see a lot of nodes in the neck or elsewhere, and we see rashes which are painful, suddenly the issue, we should just think of it. Oh, it's a red flag. So we have to also spread awareness among the family physicians, the first contact physicians. Then, as Dr. Manu said, the hospital has to be prepared. So we should have definitely some, triage like area in the emergency rooms. If such a patient arrives, what is the protocol? How to immediately prevent spread of infection to the healthcare personnel, and how to immediately isolate the patient. Every city usually has some isolation wards in certain hospitals where you can isolate these patients, and then of course management will be after that. So we should encourage preventive behavior that starts from an individual, like hand sanitization, normal surface sanitization. How we always have been doing it last, up in during H1N1, during COVID pandemic. Hygiene of self and home is very important. Hygiene of workplace is very important. And whenever we get some prodrome, we have to self isolate as much as possible so we don't infect the others. And next step, of course, is awareness among the healthcare authorities. Yeah, I think that's.
Thank you so much, Doctor, for providing us with these insightful information on spreading the public awareness. Moving ahead with Dr. Shareek, I would like to ask you about the global role. Like, what role do the Global Health Organization play in monitoring and responding towards Mpox, and what are the objectives and effective towards their efforts?
See, like any other global diseases, the WHO is in the forefront of preventing mpox in this scenario, and probably they have released a very good document somewhere 6 months back where they have defined the strategic framework for enhancing prevention and control of mpox. So they have literally given a framework from 2024 to 2027. So which means for me, it means that this is not going to settle in 1 year time. So it's going to be a long game. It's like a test game, unlike a COVID where you get all the cases in a simultaneously. But this is going to be a long game. That's why WHO straight away said we are going till 2027, and they have fixed goals for each year. They have fixed goals for each year, so that by 2027 we will be able to implement all these things. So they have put around six. Basically, they have put around six points for the prevention, and as we know that what is very important is surveillance factor. So they have put in 2024 they want to create some national to put it as a notifiable disease. So they have some put some points for each year where they have to achieve. That's the time frame they have kept. And then there's a community awareness, how to create community awareness. And then they have put on the how to treat the treatment protocols with this mpox, what to do with that, and more of research with mpox. There's another criteria which they have put. And then access to the countermeasures like diagnostic, how to improve more diagnostics, and then vaccine availability. Though they have created a long list till 2027. So all the government, including our government, are part of the universal surveillance network system. And this surveillance system, that is what the early notification, that is very important from the WHO point, because we need to know where exactly these cases are increasing. So I think WHO is doing a great job with this mpox, and I think by 2027, that's what they have said, we will reach a state where we will stop it. That's where they are. So it's not going to be very acute one. A lot number of cases are not going to come out, but slowly it will be there, and slowly it will going to progress. And it's very early to come to a conclusion that this is not working or this is yet working. So it is just on the beginning phases, but hopefully we will be able to contain it, because the rapidity with which this disease is progressing is very slow. It's not very rapidly progressing. So we'll get some time, unlike other flu-like pandemic, we will get some time. And if all the nations join hands together, probably I think we can have a better outcome with this. I've read that document. It's a very good one. So probably if we can follow that, we will be able to contain. I'm very optimistic. Thank you.
And I
Thank you,
just want
Dr.
to
Shareek.
add, can I add to
Yeah.
Dr. Shareek's points? So I work with the CEPI funded, which Aparna was talking about. I'm a co-lead for special population, basically children, pregnant women, and immunocompromised hosts. And there is an organization that is consulting for CEPI called Safety Platform for Emergency Vaccines. And part of our safety collision of CEPI, there are organizations which are pro in safety surveillance, hospital-based surveillance. There's something called GBDN in incest. So a lot of organizations, we are getting real-time information of how various organizations are taking efforts. And a lot is going on. CDC, NIH, WHO, individual countries, as Dr. Shareek, pulling in their support. And that's what global, when they said there is a global, how they declared, WHO declared it of global concern, that all these organizations come together to help. And all these safety collisions, actually, we have compiled a proposal to, once the vaccines are launched in these affected areas, how to do safety surveillance, hospital-based, active surveillance, cohort event monitoring. We develop standardized tools for them to use regarding evaluating adverse event of special interest. So a lot is going on in background. Currently there is a meeting going on for 4 hours where experts from across the globe with WHO are sitting together. African CDC is really involved as well, who are sitting and discussing. So a lot goes behind, which public doesn't get to know, but we being in the forefront with these organizations are aware of.
So thank you so much, Dr. Manu and Dr. Shareek, for providing us with this insightful information. And moving ahead with Dr. Aparna, so I would like to ask, have there been any groundbreaking research findings recently that could change the way we are approaching as of now towards the mpox?
Muted.
Dr. Aparna, we cannot hear you. Yeah.
So while we're talking about, mitigating, how do we do the prevention or spread transmission? So what groundbreaking research? Basically, we had an outbreak in 2022 prior to what we have now. So when we talk about, the existing medical countermeasures against mpox, they were originally, again, I reiterate the same thing. They were originally developed for the orthopox viruses like smallpox. Earlier lineage of the mpox, but right now we have this heavily mutated clade 1b lineage, and that is something which we're looking at, more research and things coming in. But I would like to highlight here a global case series which was published in Lancet earlier this year about mpox in people with past infection or complete vaccination course, and it concluded there that the natural and vaccine induced immunity are not fully protective against mpox infection, although the severity and duration of the disease in that series was less. But this is so much unlike smallpox, where an infection, a natural infection is known to confer lifelong immunity, and smallpox vaccine has more than 95% efficacy. So we're still learning about the smallpox. The mpox vaccine and how well it is providing protection in the real world. And so what we see, going on right now is monitoring and reporting of the genomic epidemiology of the isolates. So in all the affected countries in Africa, they are reporting the isolates for genomic epidemiology, and this can really shed light on the real world effectiveness of the vaccines and benefits of even the antivirals like tecovirimat in context of clade 1b. And as we also just mentioned, WHO is actually having a research and innovation meet right now, which is right now going on as we speak. And it actually is, the goal of this is to align all the research efforts with, outbreak response strategies to effectively mitigate all the mortality or morbidity, look into transmission and development of vaccines, diagnostics, and therapeutics to prevent any more future outbreaks. So we are actually living the time of, mpox, where we're looking forth to more research findings because we're learning more and more about the disease.
Thank you so much, Dr. Aparna, for enlightening us with the recent research related to Mpox. Moving ahead, Dr. Manu Chaudhary, I would like you to explain, please, what are the main obstacles faced by the healthcare systems globally in managing Mpox outbreaks, and especially in the under-resourced areas?
Sure. So I think a lot of these places in Africa are war-stricken. I told that point, and that because that leads to people living in refugee camps. There's a lot of overcrowding, and that because this is spreading through contacts mostly, that's one of the big reasons we are facing with this disease in those particular regions. Second is basic support. These basic supportive care is lacking. In one of the reports, I read that even regular IV fluids were not available to address dehydration in these young children getting impacted by the disease. Face mask, gloves to take care of these patients or these infected people at home are limited. So basic supportive care is also a challenge in these areas. Third is educating people. There was a social stigma now attached because 2022 breakout, 2022 to 23 breakout was in men having sex with men. So it's very stigmatized. So people are not forthcoming with the symptoms. They are not. There is a challenge in regards to just getting to know about the current disease and how it's spreading in these regions. And fourth is what Aparna alluded to. There's a lot of unknowns. We are doing most of the things what we did for smallpox and just replicating it for this virus, Mpox. But we don't know how these vaccines, what is it going to be their effectivity, how effective are they going to be in regards to preventing disease, in regards to preventing transmission. So a lot of research is required as well. And I feel, with harmonized global efforts, keeping people up to date about what's going on, we should be able to curb this disease and avoid unnecessary panic in anywhere in the world, basically.
Thank you so much, Dr. Manu, for providing us with this information. Moving ahead to the policy and the responses, I would like to ask Dr. Rohit Garg, like what strategies should be suggested for a policymaker and care providers to strengthen the response to Mpox and for the future outbreaks? We cannot hear you, Dr. Rohit. I think you're on mute.
So basically, to mitigate the impact of any outbreak and to prevent the occurrence of any outbreak in future, it is very important to have a preparedness in hand. So it is a multifaceted approach which involves strengthening of the surveillance structure, monitoring, increasing the infrastructure of the healthcare facilities. Community engagement is very important, fostering international collaboration. So, for example, in surveillance system, it is very important to develop very robust surveillance system so that if there are cases, so they get detected with high index of suspicion and they get reported as early as possible, so that outbreak can be identified at very initial stage. So there will be improved data sharing between local, national, and international authorities, so that there is a real time monitoring of the trends nationally as well as internationally. Then regarding improvement in the healthcare infrastructure, so like all the healthcare structures, there should be training and education of the healthcare providers who are going to deal with these patients. So who are going to see them patient at the first, they are going to have the clinical suspicion. Okay, this patient look like mpox, so I need to inform the authorities, I need to inform the high personnel, so that this patient gets isolation, and so that every step needs gets taken care of. Then strengthening of the infrastructure of the hospital with respect to resources, like if there is a region which is dealing with the patients with mpox, so there should be adequate diagnostic facilities available, there should be adequate isolation room facilities available. So as far as we know that mpox is going to get transmitted through contact route or droplet route, so we don't need any special kind of airborne precautions room, we just need simple isolations room with normal air ventilation, which are sufficient to isolate these kind of patients. Then community engagement is very important. So like Dr. Manu has just emphasized about the stigma. So if there are patients who get such kind of exotic disease, so first thing is stigma. People they don't come up with their symptoms, like they are afraid whether I will be isolated to a deserted place. So this should not be there. There should be awareness about the disease, so that patient, if there is a potential exposure, they come up with their history. If they have symptoms, they should come up by themselves that okay, these are the symptoms, so I need to get tested for mpox, and if required, I'll be get isolating and any kind of treatment which is required. Then enhancing of the policy and regulations is required. So if there are policies, so there should be specifically talking about infection control policies. So like during the covid time, we saw that initially there was surge in the cases, people were unaware about use of mask, use like all the isolation, uh, social preventive measure that we used to follow, social distancing, use of cuff etiquettes. But then after this covid pandemic got down, then people forgot about these measures. So reinforcement of these measures is very important. So should be the part of any kind of preparedness, that despite whether there is an outbreak or not, any kind of precautions which are required to deal any kind of infection, so there should be a continuous reinforcement of these type of precautions wherever the situation arise. And lastly, there should be international collaboration. Like as sir has already emphasized, that WHO has been on the upfront since the beginning to mitigate the impact of this mpox outbreak globally. So I think this is required from the policymakers and healthcare providers, so that we can mitigate the mpox outbreaks early.
Thank you so much, Dr. Rohit, for providing us with great responses and insightful measures that we can opt. So, our aim for this panel discussion today was to address and highlight the global outbreak for Mpox, and I would like to that it has been addressed very wonderfully by our experts, and that too in an appropriate, informative manner that one layman can understand it from A to Z. So, in the end, I would like to thank all the panelists for this insightful discussion we had today. Thank you. Thank you so much.
Thank you. Thank you,
Thank
Dr.
Thank
you.
you. Bye-bye.
Thank
Yeah.
you so much.
Bye.